Hey, good morning, good afternoon. Welcome to Meet the Expert by Care Transformation Studio, where we talk with leading experts in innovation, healthcare, and technology who are transforming care delivery through their mission and their work. Joining me today is Cynthia Kilroy, the CEO of CCK Health Consulting and an expert in the Care Transformation Studio. If you haven't met Cynthia before, Cynthia is a healthcare industry executive with more than 25 years of experience leading healthcare strategic innovations and transformations for public and private companies. Cynthia's background as a CEO, and Chief Strategy Officer, Chief Growth Officer, and Acquisition Leader brings expertise to create and commercialize new products and services with a focus on strategies for growth. Cynthia advises startups, venture, private equity, providers, payers, digital health companies, and service providers in leading innovation, defining strategies, financial management, building partnerships and commercialization, and reconfiguring operations. Cynthia led the business thesis, acquisition, and integration of a revenue cycle management company, becoming CEO of the organization. She also led the development and execution of an accountable care organization, bringing together a payer, provider, and employer, achieving a $37 million cost reduction in medical spend during the first year. Cynthia honed her talents at top-tier consulting firms, hospital systems, and health plans, including United Health Group, Optum, Blue Shield of California, Cognizant, Trizetto, Huron Consulting Group, Anderson Consulting, KPMG, and McKesson. She currently serves as a strategic advisor to Decode Healthcare and Lookout Healthcare, and she served as a board member of St. Francis Hospital in San Francisco, leading the Strategic Planning Committee. All right. Welcome, Cynthia. Thank you so much for sharing your time with me today. I'm so happy to meet you.
It's great meeting you, Matt. I've never had anybody read that to me, so I was like, oh, that sounds great.
You're like, so that's the bio. Okay, right. There you go.
I like it.
There you go. Well, it's incredibly impressive. I'm honored just to have the conversation with you today, and really my hope for this episode today is really just to help our members, help folks in Care Transformation Studio, one, get to learn a little bit about you and the specific mission that you're on in healthcare, and two, you just have such an interesting story. As I kind of dove into the internet and got to learn a little bit about you, prepping for this call, you've just done some really important and impressive work. So I'd love to dive in, share that experience with folks, and just have a conversation today. So
wonderful. I'm looking forward to it.
So first, I always ask folks in this series is, how did you get involved in healthcare? And that's just kind of a big softball really to get the conversation started. But how did you get involved in healthcare? And it seems like it's taken many different avenues. So I'd love to just get the high level of what that journey in healthcare has been like for you.
Right. So I actually started in healthcare years ago. And one of the reasons why I started was my sister was in medical school and coming out into a residency. And I just started to see a need just in where the market was. And I had an undergrad in technology, and I just thought that was kind of the early days around how you're applying technology to healthcare. It was still pretty early on, but I really thought that was an interesting path. Through that path, I actually wound up getting more onto the business side and really thinking about just the whole macro level system of healthcare, and how so many things were broken, but how many opportunities there were. And now, come full circle, now I'm on the other end where my mother really is navigating the healthcare system for seniors, especially with somebody with chronic conditions. I see there's opportunities for improvement there.
One of the things that really stood out, not only that in what you just said as far as in regards to senior care, but really one of the things, as I mentioned, getting ready for this call, that stood out was the idea that you've presented kind of throughout your career, which is on continuous health engagement. It seems like a lot of your mission and your work has been around the concept of value-based care, but maybe more than that or more nuance to that. I would love to hear more about that experience, or am I on target there? I would love to learn more about that from you.
No, I think that there's definitely a passion there. And when I think about continuous health engagement, I actually always think about like an individual, right, coming into the healthcare system. And one of the things is like, when you're looking for care, when you're working with your payer, you're more of a consumer, you're more of a member, and you're thinking about things in a very different way. Once you come into the system and you need care, or it's really around how do I get that care? How do I find the right physician? How do I think about managing my condition, or how do I stay healthy? And so I think about it as that continuous engagement, where sometimes I'm acting as a consumer, sometimes I'm acting as a member, and sometimes I'm acting as a patient. And then, for me, also as a caregiver, right? So just thinking about that, and then how the personality and how and your wants and needs are very different depending on your persona that you're you know, thinking about at that point in time. So that's where I think about continuous health engagement. So that's more on like an individual level. When I think about it on a market level, I just think that everything right now to me seems so siloed. So we've got all these little companies, and they're not thinking about how do I fit into the whole end-to-end relationship or journey that an individual will take, or frankly for a physician, and how that physician is going to help you take that journey, or how a payer is going to take that journey, or even a digital health company or device company. And so I also think about it, about continuous health engagement from that perspective, and like how and where do you want to intervene, what types of interventions. And again, it can be preventative, it can be healthy, or it can be a chronic condition.
That idea that came up quite a bit, which was that whole kind of continuum of care. And then it was also talking about for folks to really start to team up and provide that kind of end-to-end workflow versus just being those point solutions, because you just can't in a seamless way engage with 200 point solutions and try to make that work. You need really kind of an end-to-end there. That makes sense.
Right. And how do the digital health companies fit into the workflow? So my first question always is well, how's that going to work with the care provider, right? The physician, and especially because every day now we go, well, the PCP can do that, right? But in reality, they can only do so much, and their team can only do so much, right? And they only get paid so much. So how do you think about how does that fit into the workflow of when somebody is getting care? But payers are starting to think that too, from a care perspective. But I also like running an RCM company. Everybody was focused on like maybe the back end, but there's the front end, where it's like the eligibility and the transparency and in pricing, and like how do I find the right doctor, versus the middle where it's like I'm documenting and I'm coding, versus the back end, right? And it's thinking about it that way, and then how can I fix things on the back that I keep coming on the back end and putting it into the front end, right? And fixing it. So I know people are focused on that, but I really feel like there's still opportunities there.
Gosh, I love that you're using those terms, because I'm more of a techie person, and that completely, like, I understand exactly what you're saying now. So this is good.
It's a process improvement from the 90s, but now using technology. And that's where like AI can come in. And I hate it's like overused a little bit, but it's like understanding and getting smarter, like what's happening in the denials. Why do I have all these denials, and putting it on the front end and fixing it? And I know there's companies doing that, but there's a lot of opportunity there, especially because the payers move the cheese every other day on what's covered and what's not. So.
After this interview, I have a story to share as well. So I'll share a personal story on that one for sure.
Okay.
So, one of the other things that I love to just explore in these conversations with experts like yourself is the idea of care transformation. Our organization originally was launched as a telehealth studio, and just kind of throughout our journey and MVP and different things like that, we've rebranded, relaunched, and really are on a new mission. I would say it's much broader than how we started, and that is really helping organizations transform care delivery. But I realized that care transformation actually means different things to different people. And so if someone were to ask you to, articulate your view or share your view on what does care transformation mean, I'd love to just get your thoughts on that. What does care transformation mean to you?
Well, not to beat a drum, but I think that you have to think about it from an end-to-end perspective, right? And there's so many different aspects of care, right? So there is the telehealth, but there's remote monitoring. There's brick and mortar. There's, and you could say brick and mortar in the physician office and in the the hospital. There's medical devices, which, digital health companies. And thinking about it is, again, how do you weave all of that together to create the continuous health engagement, right, across the system, to really transform care. And then, part of my passion is to, I think about physicians a lot and thinking about everything that we've asked them to do. And, we keep throwing a lot of information at them, but how do we help them too? If we're going to start paying them for value, then you've got to start thinking about how we can support them, but not overwhelm them with the information.
Mm-hmm.
So that's what I think about care transformation.
And as companies or as organizations are in the studio and they are joining cohorts and events, they are navigating the marketplace, and they come across you in the platform, but maybe come across your expert listing as well on the profile page and all that sort of stuff. One of the things I really love to call out are people have gifts to solve certain problems, and they have kind of a passion behind why they solve those things. And being an expert like yourself, what do you enjoy? Like, what are the things that motivate you? Is it that continuum of care that you're looking to help folks kind of navigate and fit into, or are there specific problems or challenges you would love to help these companies solve as they come to the studio?
Well, I definitely think it's how do you fit into the system as a whole is one piece of it. The next piece I also think is like that balance between payer and provider. I hate the term payvider, but I actually have been on both sides. And then I've done, I did a huge project, which you mentioned, which was building one of the first ACOs, but it was actually with a payer, a hospital system, and a large physician group for an employer, and really targeting that, right? And frankly, the first time we got in a room together, they were all ready to fight, and so over, a 6-month period, bringing them together and understanding that there's a win in it for everybody. And ultimately the win is for the patient and the member, and the employee. And so I think that's, some of the things that, I try to bring to the table just from an expertise. And I really like the commercialization piece of thinking about, the digital health companies, and some of these other companies about, what are the channels they should go after? Their immediate reaction is, well, let me go to an employer, let me go to a payer, but I don't necessarily think there's a strategic thought around it, and how, doing some voice of the customer and understanding what the market wants. And that's going to influence go to market. That's going to influence, where your resources and how much money you're going to put into those resources, how you're going to message, and then also what your product's going to look like. So that's, another area. And then ultimately it's outcomes, because I talk to so many people and they're like, well, we're going to do that outcomes later. Well, today, nobody's going to buy anything from you unless you understand outcomes, right? And so having done the value-based care, having done other, very strategic population health targets. I was an executive at Optum. Everything was around, outcomes. And am I reducing readmissions? Am I reducing inpatient? Can I move it, the site of care? How are my physicians performing? What's my network? Who's, and then segmenting out the population and understanding like how I reach out to one individual is so different than another individual. And it's not just email versus text, it's the message. So that's another area that I think I can really bring a lot of expertise to.
I love that. And it's that entire messaging, patient engagement, just, even just overcoming some of the, just helping navigate, I'm trying to make sure I choose my words carefully, helping kind of even navigate the even literacy challenges and things like that, as far as like just knowing the steps to take care of yourself, those certain things. I think that's so incredibly important. So Well, one of the other things that is incredibly important is for us to also make sure folks know where they can find you and engage with you outside of the studio. In addition to the listing here on caretransformation.studio, I know you have CCK Health Consulting. Is there any other channel you'd love for me to mention to make sure folks can find you?
You can find me on LinkedIn too. I'm very active on LinkedIn. I feel like there's a lot of great information and just insights that people provide. So I keep up with that too.
Fantastic. So we'll make sure that we post that here with the video as well. And gosh, thank you so much for taking the time, Cynthia. This has been really, really amazing. You're an incredible person. The more I get to learn about your work and all the things that you do, I'm just honored to be on the other side of this screen here getting to talk with you today. So.
Well, Matt, it was great. And like I said, it's interesting that you have a music background because from technology, there's just been a lot of people that I know that have music backgrounds that have gone into tech, and having that foundation, just understanding what I like about the tech background is it's like, how do I want to say this? You're going to edit this out, but I always think it's like the decision trees. And that's where I have an undergrad in technology and then I went back to business school, understanding what the, each of those, potential work streams are. And then, that's what I think is it's like structured thinking, kind of like music.
Ooh, structured thinking. We're going to have to do a series on that, Cynthia. You just got me. I'm going to make a note of that here before we go. Well, that wraps today's Meet the Expert with Care Transformation Studio. If you are interested in innovation, helping others transform care, or are looking for innovative companies that are really moving the needle and driving change in healthcare, I'd encourage you to check out what we're doing over at Care Transformation Studio. That's caretransformation.studio. Thanks. Have a great one.